Hello there. Hi, nice to meet you. I'm a registered dietitian, and this series is going to teach you everything you need to know about iron deficiency. If you are talking to your doctor about a possible iron deficiency for you or your loved one, there are 3 questions that you need to ask. Firstly, if you're told you're anemic, you need to ask, what type of anemia is it? Because though iron deficiency causes the majority of anemia in the world, it is only one of many causes. Anemia can be caused by a multitude of things beyond iron, such as genetic disorders, heavy menstruation, injury, other types of nutrient deficiencies such as folate or B12. So you want to make sure you're treating the right type of anemia. Secondly, if you're told that yes, you have iron deficiency anemia, you need to ask, did you test my iron and not just my hemoglobin? And you got to say it just like that. Because here's the problem. Because the majority of anemia is caused by iron deficiency, the World Health Organization and the CDC recommends that only hemoglobin is tested for iron deficiency. But there are 2 problems with that. Number 1, the issue I just mentioned, that low hemoglobin could be caused by other types of factors, 20 to almost 50% of the time. Secondly, hemoglobin is literally the last marker to respond to you being iron deficient. So you could be iron deficient for weeks to months before your hemoglobin drops. You could go in and get tested and they're like, oh, your hemoglobin's fine. You don't have an iron deficiency, but you do. And in the case of infants and toddlers' development, weeks to months of being iron deficient is something you don't want to mess with. Which leads to the last thing you should ask your doctor. Can I please have a serum ferritin test with a side of C-reactive protein? Serum ferritin is the first marker to respond to iron deficiency anemia. So you'll nip that bish in the bud. But it can be affected by inflammation, which is why you got a C-reactive protein test with it to rule that out. It is way more specific than hemoglobin. And if you want to get really fancy, ask for a reticulocyte hemoglobin test. It's more accurate than serum ferritin and is a real-time evaluation of your iron stores. Check out part 5 where I talk about heme versus non-heme iron.